Robert Jenrick joins us now. He's Housing, Communities and Local Government Secretary. Good morning, Shisa.
Hi, good morning.
Good morning. Are we going to have a vote tomorrow after a very long 90-minute debate on whether or not we should shut down our country, shut down our economy, close businesses that may never again reopen? Has the government carried out an impact assessment of the cost of the lockdown?
Well, the government does take advice. Obviously, the Chancellor's officials at the Treasury are constantly assessing the economic harms. We take advice from the OBR, the chief economist at the Treasury. So those thoughts are very uppermost in our minds. And Julia, that's exactly why we pursued the local regionalised approach for so long, because we didn't want to take the step of having tough national measures. But it became very apparent at the end of last week that that was no longer sustainable, that there was going to be a really serious situation within the NHS in all parts of the country within a matter of weeks, and that we had to take action.
Let me ask you the question again. Has the government carried out an impact assessment of the costs of lockdown?
Well, the government, as I said, is taking advice from our...
Shall I ask the question a third time? Has the government carried out an impact assessment?
Well, you're asking an unreasonable question because
I'm asking an unreasonable question.
Because we take advice all the time from our economic advisors. That's what the Chancellor does. He has some of the brightest people alongside him in the Treasury who are constantly advising him on the economic impacts. We take advice from the Office of Budget Responsibility, who model what's happening within the economy.
And what was that
informs
advice?
The Chancellor's actions. And all of that points to the very significant harm that's happening in the economy. Nobody is hiding the fact that there are now hundreds of thousands of people who've lost their jobs as a result of the pandemic. And it's likely that there's going to be more people who will lose their jobs.
So the government has been given advice.
That's why we approach these measures with a heavy heart.
Mr. Jenrick, the government has been given advice, you're saying, on what the economic costs of the lockdown would be, and indeed, one would hope also the health and lives costs of the lockdown. We know in terms of the extra lives lost during the lockdown, something in the region of 20,000, nothing to do with COVID, but as a result of the lockdown measures. So presumably then they have carried out an impact assessment, looking up the costs and the benefits of not going into lockdown and the costs and the benefits of going into lockdown. What one might call an impact assessment. Has the government carried out an impact assessment and have you seen it?
Well, as I said repeatedly, the Chancellor and the government have taken advice from our economic advisors. We publish, or the OBR independently publishes their forecasts for the state of the economy, the employment market, and the state of the public finances. We're unusual in this country in having an independent body that does that, and that's the right thing.
Is the answer no? Should we just save everyone a lot of time? If the answer is no...
Well, what I said very clearly, Julia, is that we are taking advice.
I didn't ask you about taking advice. I'd be, frankly, pretty terrified if the government wasn't taking advice. But if the answer is no, can you be honest with my listeners and say, no, there is no published impact assessment, well, no assessment that you've seen?
There's not a specific document, if that's what you're asking.
There's not a specific document. So when
economic decisions like this are taken on account of all of the information that's available to us. As I said, the Chancellor is working through the economic data. It's informed by
Yes, we said that. We don't need to say that again. With all due respect, we don't need to hear the same thing repeated again and again. So you're saying there is not a document which the government has put together looking at the costs and the benefits of not going into lockdown and the costs and the benefits of not going into lockdown. There is no impact assessment. So when Tory MPs who are worried about the effect of lockdown, when they ask, can they see the impact assessment that the government has carried out, there isn't one to be published. Is that correct? Yes or no?
Julia, we took this decision in
Is
light
that correct?
Of
yes or no, sir?
Julia, I think let me finish my point because it's important.
Will you then answer my question?
Here, because we've taken this decision with a heavy heart. None of us wanted to put these extra measures in place, the burdens that they bring on businesses and the harm it will do to people's livelihoods. But the very clear advice that we received towards the end of last week was that the NHS was likely to be overwhelmed in many parts of the country, including in places where the rate of the virus was comparatively low, like places like the West Country. And
the NHS is going to be overwhelmed in the West Country.
No reasonable Prime Minister could ignore that advice. That was absolutely clear. It was that by early December, the NHS was likely to be overwhelmed and NHS staff were going to be placed in impossible situations. We couldn't take that course. We had to take decisive action. Of course, what we hope and expect will happen now is that as a result of these decisive measures, by the 2nd of December, we'll be able to exit that return to the proportionate regionalised approach that we've pursued so far, and that will enable significant restrictions all over the country.
OK. You are aware that when the Prime Minister on Saturday night told us that 4,000 people a day could die as a result of one of the predictions that had been seen, that Cambridge University computer modelling has already been completely debunked and was debunked on Sunday night. It was not only 3 weeks old and has since been updated with far, far lower numbers, but that model itself predicted that we would, by the weekend, have had 1,000 deaths a day. We're on roughly 250 deaths a day on average. So nothing like the numbers that were predicted. Do you think that we should be going into a lockdown costing, billions to the economy, probably millions of jobs, tens of thousands of businesses, affecting people's freedoms, probably in the long run, as the World Health Organization has said, not save any lives in the long run? And we're doing that, A, without any impact assessment on the costs of that, and B, based on computer modelling that we already know is wrong.
No, that's not correct, Julia. The
What's
Prime
not
Minister
correct?
and his science. Well, you're referring to, I think, one slide. The Prime Minister's advisors, the Chief Medical Officer and the Chief Scientific Officer, laid out a whole range of different measures that they've taken.
That was the one the Prime
into
Minister
account,
chose to quote.
which they have advised the Prime Minister. To me, the most telling of all of the pieces of data that they presented to the Prime Minister and to the public that day was the profound impact on the NHS. We see that happening in our hospitals across the country. In my local area, in Nottinghamshire, there are more people in hospital now with COVID and more using ICU today than there were at the peak of the first phase of the virus. That's the same in many other parts of the country. And it's that very serious impact, very real, undeniable, in hospitals across the country that is driving us to take these further steps.
Why are the hospitals in the hardest hit part of the country not seeing any greater?
In other parts of the country.
Mr. Jenrick, the hospitals in the parts of the country like Liverpool and Manchester, some of the most hardest hit parts of the country at the current time with the virus, they are not seeing any capacity of ICU units any higher than they normally would this time of year. Why is that?
No, that's not true.
That is true.
The data was very clear that there are in many cases more individuals in hospital. You
do know that these statistics are publicly available.
And the advice that the Chief Medical Officer gave to the Prime Minister was clear, that even taking into account all the extra capacity that we've built up over the course of the year, including the Nightingale hospitals, by early December, it was likely that the NHS would be overwhelmed. I don't think any responsible Prime Minister with that advice could have done otherwise than the Prime Minister's done and suggest that we're going to take further tough national measures for a limited period.
I would argue that a responsible Prime Minister would check with the actual data, which shows that infection rates in all of the areas which you are talking about are actually either slowing, level, or are going down.
No, in some of the places,
yes.
Some of the places that you're referring to, the number of cases has plateaued. That's as a result of the measures that have already been taken. That's a good thing. But we're also seeing in many of those places the age brackets continue to rise, so the infection rising up the age brackets. And so, yes, there are fewer younger people in some cases having the virus, but more people in the older age brackets, who are those who are most likely to be seriously unwell and hospitalised. And we are continuing to see serious pressure on the NHS. Unfortunately, you're seeing that very vividly in Liverpool. That's one of the reasons why we've chosen Liverpool, of course, today to be the first
for mass testing. Okay, let's talk about Liverpool then, because cases overall, this is official figures. I'm not making this up. It's not a matter of opinion. Official figures show cases overall peaked a week before the Tier 3 restrictions were imposed on the 14th of October. They have dropped steadily ever since. There's no noticeable drop-off after Tier 3 was introduced. And if you mention the age breakdown, there has actually been a significant fall off in the 60 to 69-year-old age group, and the median age in ICU currently is 61. So there's the cases in over 60s are the what that drives admissions to hospitals. Those are the people who have to worry about getting sick, getting very sick, and then possibly dying. And cases in over 60s have actually gone down in the last 3 weeks. So those are the official figures from the NHS. And you're telling me, no, those cases are on the up.
Well, what we're discussing today, Julia, is that in Liverpool, we're going to be introducing mass testing, which will help to take forward the efforts that have been going on, I think, with great success.
Are you going to address my question, sir?
Well, I'm not sure what figures you're quoting.
You're not sure what figures I'm quoting. Well, I can send them to you afterwards. They're from the website coronavirus.data.gov.uk, the official government figures on coronavirus. I don't know if you're going to count those as trustworthy or not. The official figures tell you that the infection rate is going down, admissions to hospitals are going down, over 60s admissions to hospitals are going down, and they were going down before you even had tier 3 in Liverpool, and they're still going down now. And you've just told me, no, they're going up, and that's why we need to have a lockdown. I'm telling you, if the reason why you think we need a lockdown is because infections are going up, you're wrong.
Well, the rate of infection, let's step back. The rate of infection is above R is above 1 in all parts of the country.
But going down.
The number of cases is rising in many parts of the country. And the very clear advice was that NHS hospitals were likely to be overwhelmed in many parts of the country.
Even though infection rates are going down.
You might take that advice lightly. I think the Prime Minister was right to take that seriously. And I think most reasonable people listening to your programme today would say that if a Prime Minister is advised by the NHS, by the Chief Medical Officer, that the NHS was likely to be overwhelmed despite all the extra capacity.
Despite infections going down.
By the first week in December, that we therefore need to take further actions. As I say, it appears that your argument is that we should ignore that advice. And
my argument is that we should look at the facts.
Right.
I know this is old-fashioned, but I think it should catch on at some point when we are looking at destroying our economy, destroying people's lives and livelihoods. Yes.
Well, I think you're making a false argument there, because none of us would want to be taking these measures lightly. You can see that there were many others who were asking for further measures, for full national lockdowns, long before we took this difficult decision. For us, it wasn't something that we relished. We want to protect people's livelihoods, and we're acutely conscious of the impact of these measures. But we do have to take heed, in the end, of very stark advice.
All right. I know we're out of time. There's lots I want to ask you about furlough, but it took us a long time to get to where we were on these figures. One final question. Which of your homes are you planning to spend the lockdown in this time?
Well, I'll be working throughout the lockdown because I've got an important role within the government, and I'll be working with my fantastic team here in Westminster. So
you'll be staying in London, or will you be travelling to your constituency or to your family home in Herefordshire?
Well, Julia, my thoughts at the moment are purely on my job. I'm working hard to try and
You don't know where you're going to be for the next month?
I'm working extremely hard in Westminster, Julia.
I didn't suggest you weren't, sir. I remotely suggest you weren't. I'm asking where there was quite a lot of concern about that you travelled to your second home during the first lockdown against the rules in place then. I'm asking if you were going to be doing that this time round.
I've been very clear, Julia. I'm going to be in London. I'm working extremely hard to try and support my department and the fantastic people who work alongside me through the weeks ahead.